We'd like to thank today's witnesses for joining us, whether in person or thanks to the wonders of technology. We are fortunate to have Senator Ron Wyden chair today's hearing on the National Broadband Plan and the impact it may have on healthcare, telehealth for seniors. Senator Wyden.
Thank you very much, Mr. Chairman, and for all of your leadership and particularly putting the field of aging on the side of innovation all through the health reform debate. When we talked about the future of healthcare reform, you constantly kept coming back to the question of how we look not just over the next few years, but into decades ahead. This gives us a chance to do that. I thank you very much for your leadership, and it's a pleasure to be able to serve with you. Today's hearing is about how new healthcare technologies that use a high-speed internet connection can better meet the health needs of America's seniors. These new technologies can save the older people a trip to the doctor or, in tragic instances, to the emergency room. I'm of the view that a number of these technologies will save Medicare money in the years ahead. So for the purpose of this hearing, I'm going to call these new technologies e-care, and it is also a subject that the Federal Communications Commission is focused on. And I want to take a minute to just talk a little bit about the possibilities for e-care. And I'm going to use a couple of devices to highlight it. I'm old enough to report that I always call them gadgets. But what we're talking about folks, for example, using is a device like this. It isn't on the market just yet, but what this is in effect a high-tech Band-Aid. It attaches to a patient's skin, and it's loaded with drugs that are administered in the exact way the physician prescribes. That's wirelessly. That means that a doctor can vary the dose based on the information the doctor receives. The patient doesn't have to go into the doctor or the pharmacy to change his or her prescription. So then we go to the next device. We call this, I guess, some version of a HealthPAL. This device connects to other devices that would measure a patient's blood pressure and glucose levels. Obviously, areas that any physician treating a diabetic patient wants to know about. It then wirelessly uploads the data to an electronic medical health record that is monitored by a healthcare professional. So then we go to one of my favorites, a third device, and in effect, this is a product that's available on the commercial market now. So what you do here is you, in effect, put your finger in it, something along the lines of what I'm doing, and this particular product measures the pulse and the level of oxygen in a patient's blood. So right here in this small device is critical information for those patients who have cardiovascular disease. And then this device transmits the data to what the physicians call their smartphone and an electronic medical record. So then you get a readout that in effect confirms to your spouse that you have been eating properly and exercising. So the last device that I would bring before the committee, politely, if I could characterize it, attaches to a patient's chest to monitor the heart. And this will, in effect, produce data that uploads to a physician, enabling that physician to call the patient if there is a problem. So this small device can help prevent a heart attack among America's seniors. Now, many of these devices are targeting the population that have chronic conditions. These are the folks who might make up perhaps 10% of those on Medicare, but whose care each year accounts for up to 85% of all Medicare spending. I'm of the view that e-care could be a huge step forward in improving the care for older people and lowering costs to Medicare as a government program. At the same time, this is a matter that Senator Corker and I think, talked about during our times of negotiating how we might pursue cost containment. I want to make clear that I'm not of the view that everybody ought to be able to run up with a gadget and say, okay, let's now make this eligible for Medicare reimbursement. This is going to have to involve a program to really scrutinize the cost effectiveness of the various products and what they will do for the patient. We know that Don Berwick has been nominated to head an important office in this area, the federal Medicare program, and I think that he ought to examine e-care as one of his top priorities. And the reason I feel so strongly about this is that the Medicare reimbursement system is fundamentally flawed. We saw in the course of the Medicare reform debate that in many respects it rewards inefficiency, and it generally only pays the older people when they go in person to the physician's office. So in effect, you have a system that literally rewards volume, rewards people who come in, whether or not that might be the appropriate approach, and you will have, in my view, if that persists, greater expense for Medicare and the taxpayers than you would have if you looked to the kinds of technologies that I've offered the committee here today that could allow people to be cared for, I think, in a more constructive way at home, produce better quality and more timely care at a cheaper price to taxpayers. So among other things, I hope today's hearing will help spark rethinking the way Medicare pays doctors. At this point, Medicare barely acknowledges the existence of e-care. Medicare spends over $400 billion a year. About $2 million is spent on these kinds of technologies. In particular, I think these e-care technologies could reduce hospital readmissions, which could in turn save the Medicare program from substantial costs in the years ahead. Only when the country has a reliable broadband infrastructure and policies in place to encourage the development and deployment of innovations in health care will it be possible to transform the health care system that is today all about sick care into one that finally focuses on health care and keeping our folks well.